Tacrolimus, a potent immunosuppressive drug, has emerged as a game-changer in the field of medicine. Its ability to modulate the immune system has made it an invaluable tool in various therapeutic areas. In this comprehensive video, we will delve into the world of tacrolimus, exploring its typical uses, benefits, potential adverse effects, recommended dosage, and associated risks. Tacrolimus, also known by its brand name Prograf, belongs to the calcineurin inhibitor class of medications. It works by suppressing the immune system's response, making it particularly useful in preventing organ rejection after transplantation and managing autoimmune disorders. However, its applications extend far beyond these realms, and we will uncover its diverse applications throughout this video. Typical uses of tacrolimus. Tacrolimus finds its primary application in the realm of organ transplantation. It is widely prescribed to prevent rejection in patients who have undergone solid organ transplants, such as kidney, liver, heart, or lung transplants. By suppressing the immune system's natural response to reject the foreign organ, tacrolimus significantly increases the chances of successful transplant outcomes. Beyond transplantation, tacrolimus has proven invaluable in the management of various autoimmune disorders. It is commonly used to treat conditions like Crohn's disease, ulcerative colitis, rheumatoid arthritis, lupus nephritis, myasthenia gravis. In these autoimmune disorders, the body's immune system mistakenly attacks its own tissues, leading to inflammation and damage. Tacrolimus helps to modulate the immune response, reducing the severity of symptoms and preventing further harm. Additionally, tacrolimus has found applications in the treatment of certain skin conditions, such as severe atopic dermatitis, eczema, and psoriasis. By reducing inflammation and suppressing the overactive immune response, tacrolimus can provide relief and improve the quality of life for patients suffering from these chronic skin conditions. Benefits of tacrolimus. The primary benefit of tacrolimus lies in its ability to prevent organ rejection and manage autoimmune disorders effectively. By suppressing the immune system's response, it significantly increases the chances of successful transplant outcomes and helps alleviate the symptoms of autoimmune diseases. Moreover, tacrolimus has demonstrated improved efficacy and safety profiles compared to some other immunosuppressive drugs. Its targeted mechanism of action allows for more precise modulation of the immune system, reducing the risk of systemic side effects. Patients who respond well to tacrolimus often experience improved quality of life, reduced disease activity, and better overall health outcomes. Additionally, the availability of different formulations, such as capsules, ointments, and injectable forms, offers flexibility in administration and enhances patient compliance. Potential adverse effects of tacrolimus. While tacrolimus is a powerful and effective medication, it is not without potential adverse effects. As with any immunosuppressive drug, tacrolimus can increase the risk of infections, including opportunistic infections, due to its suppression of the immune system. Some of the common side effects associated with tacrolimus include kidney dysfunction, tremors, headaches, gastrointestinal disturbances, nausea, diarrhea, constipation, hypertension, high blood pressure, hyperglycemia, high blood sugar levels, electrolyte imbalances. Additionally, long-term use of tacrolimus may increase the risk of developing certain types of cancer, particularly skin cancer and lymphoma. Regular monitoring and follow-up with healthcare professionals are essential to detect and manage any potential adverse effects promptly. Recommended dosage of tacrolimus. The recommended dosage of tacrolimus varies depending on the specific condition being treated, the patient's age, and other individual factors. It is crucial to follow the prescribed dosage and administration instructions provided by healthcare professionals. For transplant recipients, the typical starting dose of tacrolimus is 0.1 to 0.2 mg per kilogram per day, administered orally in 2 divided doses. The dosage may be adjusted based on the patient's response, blood levels, and potential side effects. In the treatment of autoimmune disorders, the recommended dosage may vary depending on the specific condition and severity. For example, in the management of rheumatoid arthritis, the typical starting dose is 3 mg once daily, which can be gradually increased if necessary. It is important to note that tacrolimus has a narrow therapeutic window, meaning that small changes in dosage can significantly impact its effectiveness and potential for adverse effects. Therefore, close monitoring of blood levels and adjustments by healthcare professionals are essential for optimal treatment outcomes. Risks associated with tacrolimus. While tacrolimus is an effective medication, it is associated with several risks that should be carefully considered. One of the primary risks is the increased susceptibility to infections due to its immunosuppressive properties. Patients taking tacrolimus may be more prone to bacterial, viral, fungal, and opportunistic infections, which can potentially lead to serious complications. Additionally, tacrolimus can interact with various other medications, including certain antibiotics, antifungal agents, and drugs metabolized by the same liver enzymes. These interactions can either increase or decrease the levels of tacrolimus in the body, potentially leading to toxicity or reduced efficacy. Tacrolimus has also been associated with an increased risk of developing certain types of cancer, particularly skin cancer and lymphoma, especially with long-term use. Regular monitoring and appropriate preventive measures, such as sun protection and routine cancer screenings, are essential for patients taking tacrolimus. Pregnant women and individuals with pre-existing kidney or liver disease may be at higher risk for adverse effects or complications when taking tacrolimus. Close monitoring and careful consideration of the potential risks and benefits are necessary in these populations. Precautions and considerations when using tacrolimus. To ensure the safe and effective use of tacrolimus, several precautions and considerations should be taken into account. Monitoring. Regular monitoring of blood levels, kidney function, liver function, and overall health status is crucial. Adjustments in dosage may be necessary based on these parameters. Infection prevention. Patients taking tacrolimus should take appropriate measures to reduce the risk of infections, such as practicing good hygiene, avoiding exposure to individuals with contagious illnesses, and promptly reporting any signs of infection to healthcare professionals. Sun protection. Tacrolimus can increase the risk of skin cancer, particularly with long-term use. Patients should use adequate sun protection, including wearing protective clothing, applying sunscreen, and avoiding excessive sun exposure. Medication interactions. Patients should inform their healthcare providers about all medications, supplements, and herbal products they are taking to avoid potential interactions with tacrolimus. Pregnancy and breastfeeding. Tacrolimus should be used with caution during pregnancy and breastfeeding, as it may pose risks to the developing fetus or newborn. Consultation with healthcare professionals is essential to weigh the potential benefits and risks. Adherence to treatment. Consistent and proper adherence to the prescribed dosage and administration instructions is crucial for achieving optimal therapeutic outcomes and minimizing the risk of adverse effects. Alternative treatments to tacrolimus. While tacrolimus is a highly effective medication, there may be situations where alternative treatments are considered. In some cases, other immunosuppressive drugs, such as cyclosporin, mycophenolate mofetil, or sirolimus, may be prescribed as alternatives or in combination with tacrolimus. For certain autoimmune disorders, biologic agents like monoclonal antibodies, e.g., adalimumab, infliximab, or targeted synthetic drugs, e.g., tofacitinib, baricitinib, may be explored as alternative treatment options. In some instances, non-pharmacological approaches, such as dietary modifications, lifestyle changes, or complementary therapies, may be recommended in conjunction with or as an alternative to tacrolimus, depending on the specific condition and individual circumstances. It is important to discuss all available treatment options with healthcare professionals and weigh the potential benefits and risks before making an informed decision. Conclusion. Tacrolimus has revolutionized the field of medicine, offering invaluable therapeutic benefits in organ transplantation, autoimmune disorders, and various other conditions. Its ability to modulate the immune system has made it an indispensable tool in preventing organ rejection and managing debilitating autoimmune diseases. While its efficacy is undeniable, it is crucial to carefully consider the potential adverse effects, risks, and precautions associated with tacrolimus use. Close monitoring, adherence to prescribed dosages, and open communication with healthcare professionals are essential for ensuring safe and effective treatment outcomes. As with any medication, the decision to use tacrolimus should be made in consultation with qualified healthcare providers, taking into account individual circumstances, potential risks, and alternative treatment options. If you or a loved one are considering tacrolimus as a treatment option, it is essential to consult with a qualified healthcare professional. At our clinic, we offer comprehensive consultations and personalized treatment plans tailored to your specific needs. Our team of experienced physicians and specialists will guide you through the process, addressing any concerns or questions you may have. Schedule an appointment today by calling insert phone number or visiting our website at insert website URL. Take the first step towards better health and improved quality of life.